how did go about developing the tool? Well, as project lead, I had quite a wide and varied network of people I linked in with across Scotland who were a great sounding board for ideas and issues and the approach that we took to the development of the tool. Originally, the piece of work we were going to develop a framework where health and social care workers could work towards an integrated induction process, and very quickly my network and beyond highlighted that a more practical based tool would be more advantageous for areas to use. So that was the focus we took. There was a very quick agreement on the overarching principles and ethos of Get Going Together, which when you get a chance to view it, or if you've already seen drafts, was around good communication, respect for each other's roles, and developing a close understanding of what we all do. There's been very strong bonds between NHS Education for Scotland, the project team, and the Scottish Social Services Council, which formed the steering group for the project and helped direct the focus and direction of the project. The formal focus groups were held in December of last year, and there was 3 formal large groups in Glasgow, Aberdeen and Edinburgh. And these sessions were extremely beneficial in getting the views of practitioners, people from training and development and managers to contribute into the service, the development of Get Going Together. I'd just like to take this opportunity for thanking the people that attended that group. It was extremely important for us to get that feedback. Shortly after the formal focus groups, the document out for a nationwide consultation. Again, it should have went to all areas, and certainly umbrella voluntary organisations as well to contribute. And there was often these consultations you get a mixed bag of response, and a very good response to the consultation, positive feedback with a lot of suggestions on how to improve the tool and streamline it. During the consultation process, we've done some very small-scale field testing of the tool, and the feedback from, I was delighted with the feedback from the field testing. It has been tested on a number of people new to a service, and very positive feedback from that. However, I would also like to add, as a side effect of the tool, one of the areas actually used it as a team development aid. It wasn't designed for that purpose, but actually the feedback from that process, they used some of the activities and exercises within a team setting, and the feedback came back as quite productive, so I just wanted to mention that. Okay, I just wanted to mention the tool. As I said, it's we're nearly there. It's currently at the printers for the paper version of the tool. Hoping that mid-April we'll be able to do a sort of virtual sort of launch. Like Keith, I think we were quite keen to make sure the tool could evolve in any way and react to the evaluation. So primarily we're keen for it to be a web-based resource. So it certainly will be on the NES and Scottish Social Services website, hopefully in 2 weeks' time. We went for this traditional round disc, Keith. So hopefully there'll be no debate about what it is. Paper copies. The feedback from the focus groups, people in areas still wanted access to a paper copy. So I'm making sure this will be a modest amount of paper copies, certainly for areas to use as examples. And certainly for the steering group, you'll get a sample copy. For the seminar groups this afternoon, you'll get a sample copy for those who are attending that group. The evaluation, the process of evaluation, we're taking sort of 2 strands to it. There's an inbuilt individual evaluation sheet at the back of each of the Get Going Together. And we're hoping that people, when using the tool, are able to give feedback in relation to the use of the tool. primarily the feedback we would like to see coming back, that this has aided somebody's learning and sharing and understanding during the first 6 months. Additionally to that, if we're obviously able to track has this tool been used or looked at and downloaded on the websites, that gives us an idea of numbers of people interested in looking at it as well. So thank you for listening this morning, and myself and Daniel look forward to seeing people at the seminars this afternoon.